Started. First, I'd like to welcome everyone. My name is Ashley Mangum, and I am the Director of Kids Mental Health, Pierce County. And if this is your first time joining us, first, welcome. If you're not familiar with Kids Mental Health, Pierce County, we are a coalition of people and agencies that have come together here in Pierce County to really help and address the growing needs of the behavioral health crisis among school-age kids here in Pierce County. And our overall goal is to develop a coordinated system of care in Pierce County that serves all kids at the right time, at the right level, and as close to home as possible. And so we like to do these community webinars to really be able to share information and highlight ongoing resources that are available to our kids and families here in Pierce County. So I am joined today by some great community partners that I will introduce here shortly. But I just wanted to let everyone to know that today's Lunch and Learn is to highlight the Kids Mental Health Pierce County Community Multidisciplinary Team. So we have a short agenda for today. We want to provide a little bit of background about the development of the multidisciplinary team, how it's been utilized as a resource here in Pierce County, and how to access that if that is a resource that is needed for anyone that you're working with or you as a community member here in Pierce County. So I'm super excited to have the team here. We also want this to be a community forum. So if there's any other participants on the call today that's participated in MDT, please share that in the chat. Also use that chat box for any Q&A, and we'll definitely do our best to address those questions during the webinar. And we'll also have some time after we share a little bit of information about the Kids Mental Health Pierce County MDT after that. So before we get started, if you could please just let us know who's here with us today in our Lunch and Learn. Hopefully you are enjoying your lunch as well. If you want to put in the chat your name, maybe what organization you're with, or if you're a parent or caregiver, you know, what part of Pierce County you're in, that would be really helpful for us today. I also want to note that this meeting is being recorded. We will post this to the Kids Mental Health Pierce County website in case you have to leave the meeting early or you want to share this information with any of our other community partners. So again, I want to welcome everyone. My name is Ashley Mangum. I prefer she, her pronouns, and I am the Director of Kids Mental Health Pierce County. Today, I also have Vanessa Adams, who is our program coordinator for Kids Mental Health Pierce County. She comes to us with a wealth of expertise. She was previously emergency department social worker and also was our behavioral health social worker at Mary Bridge, working with really complex behavioral health needs, kids and youth that were at Mary Bridge that were under court order, and really helping us to develop and really implement this MDT to really what it has been over the last couple of years. So super excited to have her on this Lunch and Learn with us today as well. Joining us, we also have Rebecca Vaughn, and Rebecca Vaughn is the mental health specialist at Pierce County Juvenile Court. She received her bachelor's of science degree in criminal justice from the University of South Dakota and her master's in marriage and family therapy at Pacific Lutheran University. Her love for working with youth and families can be seen through her 23 years at the juvenile court, beginning with her roles in detention, dependency, and her current role in probation. Rebecca holds an essential position at the court and has played a key role in the development of Family Council, the Alliances program, and most recently in imagining and implementing the mental health diversion program. Super excited to have Rebecca here. And then also we have Sydney Doherty. Sydney Doherty has been in the social service field for 21 years. She spent the first 5 years of her career working in the field of domestic violence at the YWCA Domestic Violence Shelter, where she advocated for women and children fleeing violence. Following her work at the shelter, Sydney spent the next 12 years at her career at DCYF, where she held multiple positions from CPS supervisor to program management. A little over 3 years ago, Sydney moved to Coordinated Care of Washington, where she served as the CLIP liaison, supporting youth who needed the highest level of mental health treatment in Washington State. Her current role at Coordinated Care is the manager of clinical operations, where she supports programming for youth involved in the Apple Health Core Connection side of the plan. Sydney has a passion about direct practice and has enjoyed doing clinical work in a hospital setting and currently as a therapist for adults and adolescents. Sydney obtained her MSW from the University of Washington in 2017 18 and is a licensed clinical social worker. So thank you to all of my panelists who are here today. It was really important for us to make sure that this MDT really reflects the community that is as diverse as Pierce County is. And so it was really important in this lunch and learn that we had participants who could share from their experiences and their systems, how convening in this cross-system collaborative approach has really helped improve outcomes for kids and families. And so again, I really encourage you to utilize that chat while we have our participants here to answer any questions that you may have. So I wanted to just spend a little time getting to a little bit of the background of the community MDTs and kids mental health as well. As I'm sure many of you know, there has been a growing need of youth behavioral health services and really understanding the complexities of when kids are coming into our systems, the multifaceted complexities that come with that, right? It's often not that we see a youth in crisis, but oftentimes we're seeing a family in crisis. We're seeing a community in crisis. And so I think it got really evident to us that it wasn't that one single system wasn't going to be able to address the complex needs that we were seeing. And it was really going to take a cross systems collaborative approach to really be able to meet families where they are and really create a safety net around our kids and families that encompass all of those different systems, supports and resources that were available to them. And in particular in Pierce County, we have a really diverse population here in Pierce County. We are really kind of tracking some of the unique behavioral health presentations that we were seeing and what some of the challenges and barriers that were coming through, our Children's Hospital, as well as our county crisis line, and the information that was available to our healthy data survey. And within that, when we were recognizing those needs, we really talked about how do we come together as a community to address these growing needs. And so in 2018, we actually had our first ever Pierce County Children's Mental Health Summit, where we brought the community together and really said, how do we work together as a community, acknowledging that these are all of our kids, and it's going to take that cross-systems collaboration and support to really develop a coordinated system of care for our kids here in Pierce County. And so that is where we formed the coalition Kids Mental Health Pierce County. And that is a community coalition that, again, is aimed at streamlining and coordinating behavioral services for school-age kids here in Pierce County. And so one of the priority actions that we identified at that time is that we really wanted to have what we were referencing at that time as a family wellness center, right? We wanted a place where families could know this is where I go when I need support for my family, for my kids in terms of behavioral health support. And we knew that that was going to take a lot of time. We knew that was going to take a lot of resources. And we thought to ourselves as an action team at that time, how do we create that resource without the physical structure of a building? And many of us came from other systems such as child welfare, where we had experience with multidisciplinary teams. And we thought, how do we utilize that structure? How do we utilize that kind of form where the intent is to streamline and coordinate resources and referrals, and also reduce, victimization and trauma for kids and families that are entering into that system, right? Right now, it's so easy for it to be siloed where kids and families have to make multiple calls to get access to services or have barriers to filling out applications or following up on really high needs. And so how do we create that environment of that family wellness center without that physical structure of a building? And we came up with the idea of having these community multidisciplinary team meetings. And so today we wanted to share a little bit with you about that MDT process, what you can expect, who's involved, and how you can utilize that resource if it's something that you thought would be helpful for any kid or family here in Pierce County. So I'm going to turn it over to our wonderful program coordinator, Vanessa Adams.
Hello, thank you so much for having me today. I would love to just invite Rebecca and Sydney as partners to the multidisciplinary team meeting to add information, to provide some of your experiences. I have had the absolute honor of hosting these and facilitating these and participating in these multidisciplinary team meetings for the past little over a year. And these are just two of the many community partners that partner with us. And so just add anything that you think. I'll pause and let you, if there's questions as well, please add them. So what is a community MDT? So the multidisciplinary team meeting is really family focused. I did not come from a system that utilized multidisciplinary team meetings, so these were new to me. And in watching how many folks showed up and how the goal of supporting the families was the center of these meetings was very impactful for the families that I was working with. So the goal is to advocate for the families' needs, to listen to the families, and really provide targeted support for what they're asking for. So the multidisciplinary team meetings can support with outpatient services, with care coordination. So when someone submits a recommendation for an MDT, there are different possibilities that they can choose from. And so those can be everything on this list in the middle here, or one of those things. And really the clearest picture is once the MDT facilitator reaches back out to the family and the referent and connects to them with what they're looking for. So there are two different multidisciplinary team pathways, and that's the crisis pathway and the community pathway. So the crisis pathway is for emergent needs. So those are coming from our hospital systems, our juvenile court systems, and various partners that need connection immediately to support with services to discharge from a hospital setting, from a residential setting, or from a juvenile justice setting. So for those typically occur either 24 hours later or within 72 hours. And those are virtual. All of our meetings have been virtual since COVID, but in the community when possible, we want to try to connect with one another to really support these youth and families in a meaningful way. The community multidisciplinary team meetings can be held as requested for consultation for different supportive needs, and they don't necessarily need to be emergent. Sometimes those are scheduled a little bit further out with a little bit different level of planning and not such a rapid way. So the folks that participate in the multidisciplinary team meetings are volunteers. I think that is one thing that's been the most impressive for me. These are, as Ashley said, community partners that have recognized these are all of our young people. These are all of our kids, and all of us can make a difference. And I think that we make such a higher impact when we do it together. So some of these members are from hospitals, from community mental health agencies, from you see two of them here, from insurance, from the courts. We're all so different and have such different backgrounds. And there are a plethora of folks that are invested in young people from their different lenses. So it's very complicated. These systems are challenging, they're siloed. And if I am having a struggle understanding one of these systems or many of these systems, my guess is so are these parents in crisis, so are these young people in crisis. So when we come together and have the opportunity to have questions, to hear what the family are asking, to provide support, it really can be the most impactful and the most supportive for families. Just to ask a question, who do I ask this to? Where do I go next? What can I do? And sometimes those are hard to get answers to when even as professionals, even as supports in the field, we have to do some hunting, we have to do some connecting. So the more we can work together to reduce those barriers and come together, the more supportive we can be for these families. When we schedule these meetings, we also have the opportunity to allow the family to invite who the family sees as supports. So sometimes that looks like excuse me, blood relatives and extended family. And sometimes that looks like a coach. Sometimes that looks like church or faith-based supports. These can be from an expansive background, and who the families identify as supports is who they request to come, and everyone's welcome to participate. So if a neighbor is helpful, they're invited. We also can provide specialized providers, so targeted towards what the youth needs. There are special education advocates and folks from DDA that can help families that have yet to be connected or are looking for more supports. So when we connect with these families and parents, the referents, we're able to get a direct picture of what they're looking for. And I think that that's been really helpful for the families that I've worked with. So this is just a great visual of it's family centered. It's the family first. What that family looks like is different all of the time. All of our families look different. All of our youth needs look different, but that's the driving factor behind these multidisciplinary team meetings. So like I said, who they think are their natural supports and identify as natural supports. We invite their payers, behavioral health specialists, their schools, and who's helpful at the school has been so amazing, because sometimes this young person is most connected to their para. And I've had school counselors, principals, teachers, pairs all together on these meetings with the rest of the family, the rest of the specialty providers, the system partners, and to hear the families say at the end of these meetings multiple times that this is the most anyone's ever shown up for me. I've never had this many people care about how hard this is. I've never heard so much support. So sometimes just the act of coming together and showing these families that they're not alone can be one of the biggest things that they take away from these meetings.
Sydney or Rebecca, is there anything you'd like to add to that?
I was actually just going to say, like, one of the probation cases that we took to an MDT, like the youth was really struggling in all areas, at home and at school, wasn't going, had been transferred to a new school, and COVID happened and hadn't connected with anyone at that school. And I still say, I don't know who connected the previous case manager from his old school, but that case manager came and that kid's life, like, turned. I mean, he just turned and started. He said, we're going to connect you with the right person at your new school, and just worked at engaging him in school. And when something goes right in one area of your life, it like changes things. So that youth like successfully completed probation and is doing great. So I mean, those are, and I was like, I don't know what else we can do. Maybe we should do an MDT just to see. But I wasn't very hopeful, because I felt like we know everything. But I just think sometimes for me, they're super helpful to know all the extra things that are in the community, and just to really see people support them. So it's someone that from an old school that was willing to come and support that youth in connecting with their new school. So I just think it's that out of the box thinking that has been super helpful.
Yeah, and I would definitely add on to that we are making connections much earlier on because of MDTs than we would otherwise. So as a payer, as a managed care organization, we have individuals who get assigned to work on discharge planning and connecting resources for youth who have gone to the emergency department, let's say. It is not unusual for me to be connected to within a couple hours of when a coordinated care youth enters into the hospital, where usually the process is a claim gets submitted, somebody gets assigned after the claim is submitted. So we are able to start planning for youth very early on, oftentimes who are in the hospital. And then we also are getting connected to people that we may have not otherwise known were part of the youth's life, because they've been present at the hospital or they were the person that brought the youth into the hospital. So our care coordination and care management teams are much stronger because of MDTs held in Pierce County. The people that serve Pierce County know the resources extremely well compared to other regions that don't have the same forum. So not only is it benefiting the youth or the member, which of course is the most important goal of the MDT, but it's also making the teams who work with the youth stronger.
Thank you.
And so who is eligible for an MDT? Looking at this slide, I want to say the bottom one, the youth and family must reside in Pierce County, is all that totally matters to make a referral. Now if an MDT is not necessarily appropriate in the moment, or we could look at other things prior to that, if they're outside, please reach out to me. My email, I'll add my email, it's at the end of this slideshow. But what I really want is to not let any of these young people fall away from what they need to be connected to. So what Ashley was saying, what Rebecca and Sydney are saying, we want to get them the right support close to home where they're at. We want to meet them as soon as possible with as much support as possible. So we're typically supporting complex youth involved in multiple systems or high utilizers of the emergency department, but also there's sometimes that there are just other challenges. The family has additional barriers, or they feel that they've tried all of these things and they don't know where else to go. Reach out to me, submit a multidisciplinary team meeting requests on the website. I'm happy to follow up with you as a referent and also your families that you're referring. I think that it's really important that what we identify as a good fit, a high need, a crisis, what we identify as crisis looks different for everybody. So when these families are experiencing closed door after closed door, this is an open door to a room full of people that care. And if that means that we connect together virtually, if we connect to the family, if we're just able to show this family that there are additional folks that care about them and their child, I'm happy to make that connection. I'm happy to do that.
And this is Ashley. I think just another population that I like to identify that I think this MDT would be highly useful in is youth who are transitioning back into the community. So kids who may be discharging from an inpatient unit, whether it be short-term or long-term. This is a really great forum to make sure that there is a coordinated plan that can really support that youth through recovery and reintegration back into the community. And so if you are working as a provider within those spaces, we'd love to connect to you about how we can connect with your units and really talk about how this could be beneficial as a transitional plan for when kids are coming back into Pierce County.
So that the multidisciplinary team meeting itself, they're typically scheduled for 1 hour. I try to give as much planning ahead of time so people can fit them into their schedule, but if they're emergent, then we schedule them quickly. And in the beginning of the meeting, we kind of just go over introductions and then let the family provide what they're asking for, what they need, what they're looking for. We get history from the family member or from the referents, whether the school counselor, the emergency department, social worker, the teacher. I've received them from family members themselves. And so they just provide some history and allow the team members who are on these meetings to ask questions, ask specific questions and really hear some of the challenges. And from there, we move into some recommendations. We talk about different strategies and plans, connect to different resources. And during that period of time, either the facilitator or a note taker will be taking notes so the family members don't have to struggle to try to hold all this in their memory and lock it in and remember for tomorrow. So we take notes to help the family member organize things to do to follow up on and supports that they can look to afterwards. And then following the meeting, the note taker or the facilitator will send those notes out to the caregiver and the referent. And within 72 hours, the multidisciplinary team meeting cannot make recommendations or referrals on behalf of the youth. What they can do is make some recommendations to the family, and the family can have support with follow-up. So there have been times where I have walked step by step with a family through making referrals and getting connected to those services. You can't ensure acceptance into services because these are all volunteers supporting this family. But what I've seen is really strong outcomes when we collaborate. So when there are folks that are helping the family navigate these phone calls, making follow-up calls to support the family, connecting within a week afterwards to check in on them. Oftentimes there are lists of recommendations that other people on the call are providing support. So sometimes that's looked like the payer is going to reach out to see if they have a behavioral health case manager. And if they don't, they're going to help to connect them. That happened 2 weeks ago, and it was very successful in getting this family support with some forms that they didn't understand. I've seen various components, but there will be follow-up after the meeting with ongoing support. And these don't have to be a one-time thing. Just because a youth had a multidisciplinary team meeting doesn't mean they can't have another one. If things change or look different and additional support is needed, then we definitely have scheduled multiple to support an ongoing need. So I think that the most important thing to remember is these are adaptive. These are to meet the family. These are family-centered and youth-centered with the goal of supporting them where they're at. So for information sharing, I think this is important. We get release of information signed ROI signed from the youth. I would say a high majority of the time, almost all of the time. I think that everyone has agreed to confidentiality and we have conversations in a strengths-based and respectful manner. I really have been honored to participate with such respectful and incredible and supportive colleagues and also families. And so understanding the laws around information sharing that have changed somewhat, you're able to share information as providers to support minors under the family initiated treatment. So there is some flexibility with what we can share, but in the majority of these situations, we have had release of information signed by the youth because they also oftentimes want the support. They're looking for support. They have needs that they want met. And so I have mostly experienced youth that want to be engaged or want to have their families look for different ways to support them. So how to make a referral? It's super easy. You go through the website, there's a link right there. And I think that you just follow the steps in such a clear way. It says MDT, then you fill in the information. If you're not sure what to provide, or you don't have the ROI yet, or you don't have something else, here's Ashley on top of it, opening it up to show you. So you just input the information right there, and these will come directly to me. You can add your information, family information, both of those, and you always can email me as well. And so in the case of an emergent MDT, I need an email as well to alert me that these are coming so that I will have it. But these I'll follow up on, even if we have conversation around it, even if you're not sure it's a good fit. I really want you to reach out for any young person that you feel could benefit from this. And I don't know if Sydney or Rebecca have any ideas or any thoughts around like how diverse these MDTs have been and all the various youth that have been supported. But I think there have been such a different array of young people and support that's been provided.
Hi, yeah, definitely. We've seen kind of all ages, all demographics of individuals that have wanted to have an MDT. I think one of the, kind of going off topic from that question a little bit, one of the greatest things about the MDT is that the team is coming together right away. So at Coordinated Care, we work with youth who are in foster care. We're the sole source provider for youth in foster care. And then of course, also work with bio parents and adoptive parents. And it can be extremely overwhelming to be a social worker or a parent and have to manage and try to understand all of the different people that are coming into your life after your child has gone into crisis and has gone to the emergency department or having challenges in an outpatient setting. So it's been wonderful for that whole team to come together, for the parent or social worker to be able to put names and faces to organizations to understand. I have sometimes up to 20 people that are working to support me. I'm not sure what everybody's role is and the differences between roles. So they get to actually meet all these different people that are there to support them and their youth. And I think it really helps them understand the systems in a way that is much more difficult when you're at home and you're getting maybe 5 calls in a day from 5 different organizations trying to help manage things. So that has also been a really great thing for families and social workers.
And I was going to speak to like having a youth that was in detention and needing like housing, and that youth participated in the MDT, and Ashley did an amazing job of helping that youth feel comfortable, because sometimes when the family is not ready to have them come home because of things that have happened, like it's hard to hear difficult things about your behavior. And it just felt like a really safe place for that youth to hear difficult things. And it was just a good experience for her. And then also just the resources and the push towards helping families connect with getting a proper diagnosis for their youth, getting them just, it's nice to see something happen for families that should have happened a long time ago. It happens later on. because of whatever the reasons, just to get them that support later has been helpful. And I give this information to our at-risk youth probation officer, because that's kind of when youth enter the system and don't have criminal charges yet. And our goal would be that youth they leave their adolescence without criminal charges. And so I really see her as kind of the point person for juvenile court when families are struggling and don't know what to do because they feel like their kids are getting a little out of control. And just giving her the website to give families has been super helpful, and then encouraging the MDTs. And what I think is helpful, I'm sorry, my computer keeps having all these notifications and I'm not smart enough to figure out how to turn off that sound. So if you guys hear that, I apologize. But that being the mental health person for juvenile court and then helping connect if youth do progress through our system, knowing the story and being on the MDT, and then knowing what's already kind of been. My memory is amazing for some families, and just hearing stories and then just helping them reconnect with, hey, whatever happened with that? I think I remember you from being on the MDT, like just following up on and seeing if it's something that we need to revisit and go back to, if it was helpful for them. So those are just kind of the examples that I think about at juvenile court, how they've been helpful for me, remembering families, and just for the families and youth that have participated in an MDT for themselves.
Thank you. I think I'd also like to just add that we are very intentional in who we invite to an MDT as a community partner, and really try to ensure that we have participants that can help us row our boat in the right direction to a solution or a resource for a family. And commonly, we always try to have peer and parent support. So we really partner with a Common Voice and Dad's Move to really make sure that we have other, parents and people with lived experience on those calls, so parents don't feel like I'm just in a space with all these professionals and nobody knows what I'm going through, but to actually have other participants on that call that do have that lived experience, that do come from their communities, that can really be a part of their new network of support as well after we have facilitated that MDT. And so it's been really helpful to have that network of participants. It's rare that people say no, and I'm always extremely gracious for the amount of providers that join into these calls on a short-term notice, a lot of times when we have those crisis requests as well. So we are at the time. I know that was a lot of information. All of this information is on our website, where you can access the referral and also the MDT guide and frequently asked questions that we've developed too. But since we do have our panel of experts here and participants and facilitators, I just wanted to open it up and see if there was anyone who had any questions today. Thank you. How can an organization become a partner/provider? Thank you. That's a great question. We would love to connect directly with you. If you want to email Vanessa, there's that join us button on the Kids Mental Health Pierce County that will get an email directly to Vanessa, and we'll send this PowerPoint out too, but it would be a great way. And she put her email in chat. Reach out to us directly. We'd love to connect with you, share some more information about Kids Mental Health Pierce County, learn about your organization and how we can best include you in that network of supports as well. Great question. And we'd also love to do some outreach to your organizations. We're really trying to find ways to streamline information about resources in Pierce County. I know we talk a lot about gaps and barriers and lack of services, but we have some amazing services here in Pierce County and providers and supports that are available. And so if you represent an organization or school district or any connection that we can make to help strengthen and streamline these resources down to the community and throughout the community, we would love to be able to connect with you. And you can also reach out to Vanessa or myself to see how we can best do that. Any other questions? Well, before we end, Rebecca, Sydney, Vanessa, do you guys want to share any final words about the Kids Mental Health Pierce County Community Multidisciplinary Team?
I just think anytime that you're feeling a little stuck with planning, feeling like you aren't getting all the information that you want about resources in the community, have questions about a current provider and if what they're doing is in the scope of what you feel they should be doing, it's absolutely a great forum to get together with a bunch of professionals in the community to help answer your questions and navigate a very complex system. Usually there are behavioral pediatricians on the call, which is worth $1 million to be able to just talk to doctors in time and ask questions that maybe you haven't been able to ask at an appointment, or maybe you're on a wait list for appointments with a behavioral specialist. And so there's just a wealth of information and an abundance of just really trained individuals with a great deal of experience to help you navigate a very complex system.
And I would echo what Sydney said, and just Ashley and Vanessa are amazing at getting information. Like when I have a question that I don't know how to do this, I just send them an email asking for help. And I just think anytime you get to a place where I don't know what to do, it's important to talk with families about doing an MDT, because they're so helpful and they just push people to think outside the box and include more people that are thinking from a different lens.
And I would just add that it has been an absolute honor to work with these families, because they are asking for help, and they were asking for help, and sometimes they don't know where to ask or who to ask. And in this place, I've seen so much connection made, so much support happen. And that has been really meaningful to me. And following up with these families, I've heard countless stories of how much they appreciated all of the community participants. And so I'm honored to work with the families and honored to work with the participants that volunteer for these meetings.
Well, thank you. And thank you both. I remember the early days when we were meeting to have these conversations. And, again, I just want to recognize that this is a community resource that we as a community stood up to say, again, how do we wrap our arms and link arms to really support our kids and families? And it's been amazing to see this model grow and continue to be utilized in the way that it has. And we so want to continue to partner and grow this resource so that all of our kids, again, get access to the right service at the right time and keeping them as close to home as possible. So I want to thank all of our panelists and participants for joining us here today. If you have any ideas for any future lunch and learns or any webinar topics, we'd be happy to support those. Also, please, if you have not already, check out our website, kidsmentalhealthpiercecounty.org. There are a ton of already existing resources there. We work really hard to create a regional hub of resources that really highlight and elevate existing community supports that are available to kids and families here in Pierce County. And so if there's nothing else from our participants and our panelists, I will wish you a great rest of your day. Thank you again for joining us, and be on the lookout for all things future with Kids Mental Health Pierce County. So thank you and have a great day. So there's a late question, no worries. If you have to log off, feel free to log off. So what is the difference between a MDT and WISE services? Does anybody want to take us, or would you like me to answer that? Go ahead, Sydney. I see you unmute.
Okay. So WISE services are an actual paid provider that works as a wraparound team to work with youth in foster care, youth with adoptive parents, bio parents. So it's an actual paid service. The MDT is a forum to come and get information or consultation about what is going on with your child or youth that you're working with, So you present what's going on with them, and then the team of MDT members gives you feedback and ideas about resources that maybe haven't been tried, or other kind of things that you can try in the home to meet the youth's needs. So one is just a forum to present what is going on with the child that you're working with and get feedback and information. And WISE is an actual service. So through the forum of the MDT, that might be one of the recommendations, that you go and seek getting WISE as a support in your home. Oftentimes WISE is already involved with the youth, and then they participate in the MDT and talk about the things that they've been doing that have been working well, maybe the things that they've been having challenges with. So two different scopes.
Thank you. Any final questions? That was a great question. All right, well, if anything comes up between now and anytime, again, don't hesitate to reach out to us. Again, thank you for joining us and enjoy the rest of your day.